examination. Right, so in the breast examination, what you're going to do is you will see somebody is wearing the breast mannequin. Okay, and we'll be doing the examination. So first is inspection. So in the inspection, what we have is we have got 5 steps of inspection. That's the main thing. You will be doing the 5 steps of inspection. Main is first thing, you're sitting very upright. You're sitting upright and tell the patient to put both hands on the thighs, and then you'll be commenting on a lot of things. Both the breasts are symmetrical, nipples are the same level. There is no bleeding discharge coming from the nipples. And for example, there's no visible mass, no purity orange, no dimpling, all those things we can comment. Then the second point would be tell the patient to put both hands on the side and you bend forward. And the comment would be there is no visible mass on bending forward. There is no visible mass on bending forward. Third would be you tell the patient to put both the hands on the back of the head like this. In this position, what you're checking 2 things. You're checking axillary and the supraclavicular fullness, lymph nodes. Fourth will be tell the patient to lift both the breasts with 2 fingers and you're checking the inframammary area. You're checking the inframammary area for what? You're checking the inframammary area for fungal infection, intertrigo, and you're checking it for the scar mark as well. For example, if you have to do the surgery in the breast, any station, if you any problem, if you're doing the surgery, as a surgeon, you try to put the incision in the inframammary area so that cosmetically it's much better. That's the main thing, right? And the 5th point would be in inspection, you tell the patient to squeeze both the nipples with 2 fingers like this. And you're looking for if there is any bleeding discharge coming from the nipples. Right? So that's your inspection. Then you go to the palpation. You tell the patient to lie down on the couch. Couch will be 45 degree. First, you go for temperature. So, in the breast, we have got 4 quadrants. So we have got, for example, if I'm explaining it to you. So this is my breast. So this is your upper inner, upper outer, lower inner, lower outer. So these are your 4 quadrants. So what you do, you need to compare the temperature. You need to compare the temperature in each quadrant. So upper inner, upper outer, lower inner, lower outer, lower outer. So this is how you compare the temperature, right? That's the main thing. Then you have got superficial palpation. You have got 3 palpation that you need to do. Number 1 is superficial palpation, that is for tenderness. Then you have got deep palpation, and then you have got peri-areolar palpation as well. So the deep palpation and the peri-areolar palpation is only and only done for the mass. Superficial palpation is done for tenderness. Okay. So patient is lying down on the couch, 45 degree, and what you will be doing, you will be so what you'll be doing, you'll be using this border of your hand, to do the examination. And you make sure of one thing, that you go anti-clockwise. You are not lifting your hand, because if you lift your hand while doing the palpation, what's going to happen? You might miss something very important as well. So you try not to lift your hand while doing the palpation. You go anti-clockwise and try not to lift your hand. That's the main thing that you need to do. While doing the palpation, you remember one more thing. You're not touching the nipples. You're not touching the areola as well. Right? So this is something that you need to do. You're not touching the nipples, you're not touching the areola, and you're touching the whole circle. And without lifting your hand, you need to cover it. Right? You can check it in the video. You'll be able to see how it is done. Use this border of your hand. You don't poke the fingers. Just be very careful. Not touching the nipples, not touching the areola. And where are you looking? You're looking at the patient's face for any kind of tenderness. That's what you need to do. Right? So that's really important. Yep. Okay. So that's your superficial palpation. Then, while doing superficial palpation, sometimes what can happen is you might be able to find a mass as well. My recommendation would be do not comment on the mass when you're doing superficial palpation, because superficial is only for tenderness. Now, when you're going to do the deep palpation, then you can comment over the mass in detail, in very much detail you can comment. So what are you doing? Doing the same way. Deep palpation will be done the same way. You will go anti-clockwise. Everything will remain the same. And whenever you get the mass, you will comment over the mass in detail. Just one thing you can add, when patient is lying down and you're doing deep palpation, tell the patient to put both the hands at the back of the head. They're lying down in this position. So when the put the hands like this, what's happening? The masses will become more prominent actually. That's the main aim. Right, so you'll be able to find out the mass easily. And when you find the mass, you need to comment over it. Where exactly the mass is, in which quadrant. So I can feel mass in the upper inner quadrant of the left breast or right breast. That's the thing, right? So this is something that you can comment. And what's the size of it? It is 1 into 1 centimeter. Is it regular or not regular? Is it attached to the underlying structure? Is it attached to the overlying skin? Is it painful or not? Is it mobile or not? So all these things, all those comments that you need to do. Okay. And yeah, so you check it in both the breasts. Now, after doing deep palpation, what you have is you have this peri-areolar palpation as well. The thing is, while doing the palpation, you are very clear, very careful. You didn't touch nipples, you didn't touch areola. So there might be some masses which is in the peri-areolar area, like this area, which you might have missed while doing deep palpation. So what we do, peri-areolar palpation, that's a deep palpation. How you do it? You do it with your thumb. So with the thumb you do. Again, you go anti-clockwise, and wherever you get the mass, you comment over the mass in detail. That's it. That's it. Okay. And then you can do the lymph nodes as well. So now this examination is done on the mannequin, but who's wearing the mannequin? The patient. Somebody's wearing, a living being is wearing the mannequin. So you can do all these things on the mannequin. And then you can check the lymph nodes as well, but it is a bit tricky. You know, I don't think so they will let you do the lymph node examination because you have to do it on the patient and it's very ticklish as well. And I don't think so they're gonna let you touch the lymph node. I mean, axillary, it's quite uncomfortable. But still, yeah, you can check these lymph nodes as well. You can check it in the video. Yeah. So that's your breast examination. Also, you can verbalize that we will be ideally checking the axillary tail as well. So mannequin may not have the axillary tail, right? But yes, during the breast examination, we do examine axillary tail as well. Okay, that's your breast examination. Right, let's have a discussion on the scenario. What kind of scenario you might get here? So your FY2 in the GP, patient is 44 years, presented to the GP. Patient is concerned because she found a lump in her breast. Patient found a lump in her breast. Talk to the patient history and examine and discuss the management with the patient and address her concern. All right, that's absolutely fine. Right. So what you do, start taking the history. So patient said, I found a lump. I'll simply say, tell me more. Yeah, that's the main thing. Yeah, tell me more. Elaborate. I'll always gonna go for an open question first. Exam is easy. Please do not complicate it. Go for open question. I found a lump. Okay, tell me more. Tell me more about the lump. So you will get to know where exactly the lump is. What is the size of it? Is it this much, this much, this much? Is it increasing in size? Doctor, I just noticed this morning. So I don't think so. This is going to be a good question to ask. Is it increasing in size? But if it is there for a couple of days, I can ask if it is increasing in size. Is it soft? Is it firm? Is it hard? Is it mobile or not? Is it painful or not? So all those questions I want you to ask. Some of the answers you will get, some of the answers you may not get. For example, patient said, Doctor, I noticed a mass in my left breast. Where exactly in the left breast? Is it here? Is it here? Is it here? Is it here? So if you got to know where exactly, so it is easy for you in the examination as well. So when you do the examination, life will be easy for you as well. So you know it is there, so you have to find it there. So, and history is definitely going to make sense with the examination. Whatever history they are giving, you will find the same thing on the examination as well. Yeah. Okay. So after labellation of the lump, you can ask about anything else as well. No, doctor. Okay, so now what are the associated questions, symptoms I should be asking? So remember one thing, any patient having any lump anywhere in the body, and if you do eyes later on, what do you think, what their concern would be, what their idea would be? As simple as that. Can I say they will be concerned about cancer, any mass anywhere in the body? So what I'm going to do, I'll be asking about general cancer symptoms as well here, right? So what are the questions that I have to ask? I'll ask for weight loss. I'll ask for loss of appetite. I'll ask for lumps and bumps. What else? What else? What else? I'll ask for anemia symptoms as well. I'll ask for anemia symptoms like if you have got any tiredness or fatigue, if you've got any dizziness, if you've got any heart racing, if you have got any shortness of breath. So all those questions you can ask. Yeah, makes sense. Now, one more thing, remember guys, whenever you're talking to a female, she's a female, obviously. So whenever you're talking to a female, remember P questions as well. P is your period. P is your pregnancy. P is pills, any contraceptive pills, any contraceptive methods, for example. And P is your pap smear. And even if you want to add one more P, I would say partner, right? So I'm not saying that you need to ask these P questions to every female. I'm not saying that you need to ask it in all the female, but it might be important. So just screen these questions in your head quickly. Is it important for me to ask? So what do you think? Period is important or not in this station? I would say it is very, 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 very important, because sometimes what happens is the patients, they feel their breasts are lumpy and sore when just before the menstrual cycle start, and when the cycle start, they feel absolutely okay. Right? It could be a case of cyclical mastalgia. That's why asking about the period is very important. But this patient says, no, doctor, I don't have any problem with the periods. I mean, my period was 1 week ago, so it's not going towards cyclical nostalgia. What about the pregnancy? Pregnancy is important, but the more important thing is the lactation, because if patient has done the lactation, breastfeeding, the chances of cancer will be less. That's the main thing, yeah? What about the pills? Pills is important because, the contraceptive pills, the OCPs, the COCP, I would say, estrogen, you do not be giving if there is anything specifically, right? So you have to be very careful. You won't be giving a COCP patient has got breast cancer or history of breast cancer. Yeah. Now, pap smear. Is it making sense? I don't think so. Partner, again, it's not very important as well. Yeah. So now what we're asking, we're elaborating about the lump, asking about general cancer question, maybe 1-2 questions about anemia as well, asking about the period, pregnancy, pills, that's very important. Yeah. Now, obviously, when I ask about past medical history, what else I can ask? I can ask about family history. That's very important. I'll ask for any trauma as well, just to make sure any necrosis and all, if it's there or not. I'll ask for any fever, just to make sure there is no engorgement or mastitis as well. So these are the main things that we can ask, right? In the exam, what we have to do, you hope for the best for your patient, obviously, but you need to think for the worst as well. That's the thing, yeah? Okay, and smoking alcohol, obviously, I mean, you can skip it as well because we already asked so many questions there, right? Then what's going to happen? Then you do the examination. So in examination, obviously, what you better do, you will do the inspection. If you feel I've got less time, I told you there are 5 steps of inspection. You may not have that much of time to do in the exam, isn't it? So what you can do, go for quick inspection, just the first part of it, yeah? Then palpation, obviously, yes, temperature you can do, and then you go for superficial and you go for deep palpation. So when you're doing deep palpation, what is gonna happen when you do deep palpation? Obviously, you'll find a mass, because patient said, I found a mass while taking shower. So when you do the examination, now you'll also find a mass. So what do? You comment over the mass in detail, that I found this mass, this is that, this is this, right? So you comment over the mass in detail. Yep. So that's something that you can do. Now, lymph nodes, you just verbalize, ideally I'll be doing the lymph node. I don't think so they will be letting me do the lymph node examination there, right? Now, you got the mass. For example, if I give you that mass is, for example, it's 2 into 2 centimeter, it is attached to the underlying breast, not to the overlying skin, not to the overlying skin. And what else? And it is not increasing in size, because I just noticed this morning, it's not painful, not mobile as well, right? And now, see, most of the breast lump, what is the management now? What is the management? And if you do IMS, patient is worried about cancer as well. Yeah, patient is worried about cancer as well. So the thing is, most of the breast lumps are benign. They're harmless. We have asked the cancer question as well. Patient said no to those cancer questions as well, which is a positive sign. However, you cannot exclude cancer 100%. So what we're gonna do, we will still be having 2 weeks urgent referral. We'll be having 2 weeks urgent referral. And what we're gonna do for this patient, we will be doing these investigations. We're doing ultrasound or mammogram, depending on the age of the patient, right? So that's what you need to do. And once we have the report, then we will decide if we have to go for FNSE or biopsy. Patient is asking one question, is it cancer? I can see you are worried about cancer. The thing is, you have come to us early and you do not have any alarming symptoms of cancer, which is a good sign. However, we have to investigate it further to make sure everything is fine. So you cannot say, no, it's not cancer. You cannot say, yes, it is cancer. But definitely we need to elaborate. We need to go for further investigation, right? Yes, definitely past medical history, family history is very, very important, doctor. We are not going to miss that. And routine blood, if it is in the GP, routine investigations can be done here, in the GP. But rest of the investigations, who will be doing? It will be done by the specialist when you're referring this patient in 2 weeks' time. All right. So routine blood, routine investigation can be done here in the GP as well. Okay. So that's this scenario. Let's have a look at other one as well. Patient is 40, sometime not 40, maybe say 30 or 40. Urgent appointment to discuss the problem, talk to the patient history and discuss the management. What this patient would be saying. The patient is saying, doctor, my breasts are lumpy and sore. Before my menstrual cycle starts. Now you ask all other questions. Any weight loss, appetite loss, nothing is there. Any fever, flu-like symptom, nothing is there. Any cancer question, nothing, everything is negative. PPP question, everything is negative. Just my breasts are lumpy and sore before the menstrual cycle starts. That's the thing. So after you do the history, same question that you have asked here, you can ask a couple of questions same like that as well. And you got the relationship that pain is there when before the menstrual cycle starts. So when you do the examination, when you do the superficial deep palpation, there is no mass actually. There is no mass, right? So the management, the diagnosis is you have got cyclical mastalgia. That's it. Cyclical mastalgia scenario. The treatment is painkillers. That's it. You can ask the patient to wear, you can tell the patient to wear supportive bra as well. That's it. That's the only thing that you need to do in this scenario. Right? Reassure the patient there's nothing wrong, it's cyclical mastalgia. If patient has got any other symptoms of cyclical mastalgia like headache, mood swings, you can do the symptomatic treatment. Okay. Let's have a look at another one. After in the GP, patient is having nipple discharge. So take history. You'll ask question, you'll elaborate about the nipple discharge, for how long you are having it, what is the color of it, if there is any blood in it or not, is it from the one breast, is it from the other breast as well. You'll ask for cancer question as well. You will ask for family history, fever and PPP question, breastfeeding, all those questions you will be asking here as well. Remember one thing now, when we should be alarmed in nipple discharge, if it happens regularly and it's not a just one-off event, it comes only from the one breast, if it is blood-stained or if it's smelly, you are not breastfeeding and leaks out without any pressure on your breast, you are over 50 and you have other symptoms such as lump, pain, redness or swelling in your breast, and if you are a man and having the discharge, what you should be doing, it's a red flag sign. It could be a sign of cancer as well. You can go for specialist opinion, 2 or 2 weeks referral as well. So that's another scenario that you might be dealing with, right? So what I've discussed a mass. Patient has got a mass. What we have discussed cyclical mastalgia, and I've discussed nipple discharge as well. So you'll take history in terms of examination when you find, because you're trying to find if there is any mass, you will not find any mass in that station. And management is doing the routine investigation here in the GP and referring this patient to the specialist within 2 weeks of time. All right. So that's what we have got in the breast examination. All right.